My main area of interest in gastroenterology has been colon cancer screening, specifically with colonoscopy. Colonoscopy is also a very effective tool to diagnose disorders such as diverticulosis and inflammatory bowel disease. It's commonly used as a diagnostic modality to evaluate people with problems with their bowels like diarrhea or constipation or bleeding. The current recommendations based on national guidelines for colon cancer screening are if there's no family history to begin at age 50, and then if there are no polyps found, have a colonoscopy about every 10 years. For someone who's going to have a colonoscopy, there's a preparation required the day before where you have to drink a laxative, and unfortunately you're quite preoccupied for several hours with the clean out. The next day, when you come to the procedure area, we place an IV and give medication to sedate you so that it's comfortable. The procedure itself involves insertion of a camera that's about as thick as a small finger into the rectum and then having that advanced gently under direct vision to the cecum, which is the top of the colon, and then withdrawing it over a period of about 6 or 7 minutes, looking for polyps and removing them if found. For most people, sedation is really quite adequate and they're very comfortable throughout the procedure, and a good deal don't remember anything afterwards. When people come for a colonoscopy, most of the time they're here at the Kemp Surgery Center for about 2 hours, and then the rest of that day they're tired but are able to function at home, but they can't drive or go back to work until the next day. When someone has a colonoscopy, we discuss the results in the recovery room with the patient and their family, usually right away. We provide them with a copy of the procedure report with photographs. If polyps are removed or there's biopsies, the final results usually take about 3 to 4 days.